Today in this video we are going to learn about the monophasic liquid dosage forms. What are these monophasic liquid dosage forms means? These are the liquid dosage forms which are homogeneous in nature, in which one or more active ingredients are completely dissolved in a suitable solvent or a mixture of solvent. Okay, so that means the monophasic liquid dosage forms are the pharmaceutical liquids that consist of a single uniform phase, meaning they are the true solutions where the active pharmaceutical ingredient is completely dissolved in the suitable solvent. Okay, so these are some sort of clear liquid formulations. So example for this type of formulations is syrups. So what are the syrups means? These are some sweet and aqueous solutions. Example paracetamol syrup, which is mainly used for children's. And next one is the elixirs. These are the clear sweetened hydroalcoholic solutions. Example diphenhydramine elixirs and tinctures. That is another example for this monophasic liquids. These tinctures are nothing but the alcoholic or the hydroalcoholic solutions prepared from plants or some chemical substances. Here we will adopt some ancient methods to prepare the tinctures, like percolation method, maceration, like that methods we will use to prepare the tinctures. Examples like tolu tincture, liquorized tinctures, like that, and spirits. So that is another example. What are the spirits means? These are the alcoholic solutions of the volatile substances. Okay, that is the another example for the monophasic ones. And drops, well-known doses from. These are the small volume solutions meant for oral, ophthalmic, nasal or aortic uses. Okay, and another type of dosage form is solutions for injections of or infusions. So these are the sterile monophasic solutions administered parenterally. Okay, so these are all the various monophasic liquid dosage forms. Coming to the characteristics of this monophasic liquids, there should be a uniform distribution of solute is seen in here. These are the clear and the transparent in appearance. That is the another feature, and there is no need for shaking before use. So whereas in case of biphasic one, that is especially suspensions, it is highly needed for the preparation to shake before use. So such sort of things are not needed in this type of preparations. So it produces a faster onset of action compared to the solid dosage forms, whereas in case of solid dosage forms like tablets or capsules, it needs some disintegration dissolution before giving onset of action. So the disintegration steps are involved in that, so those steps are absent, and here it will give a faster onset of action. Okay, and coming to the dose accuracy, it is some sort of high. Okay, so all these are all the various characteristics of the monophasic liquid dosage forms, and let us see some advantages. So what are the advantages of this type of dosage forms means? It has an easy to swallowing so capability, that is easy to swallowing capability mainly. So that is the main advantage, suitable for children and elders compared to the solid dosage forms like tablets or capsules. Okay, and it has a faster absorption and onset of actions compared to solids, and so flexibility dosing is highly recommended in this type of formulations, and good bioavailability is seen by this type of dosage forms. Okay, and coming to the disadvantages, it has a less stable than the solid forms, especially in the aqueous medias, and bulk and less portabilities, that is the another disadvantage, and the risk of microbial contamination. As these are the aqueous dosage forms, obviously it may prone to the microbial growth after some time and during the shelf life. So that is the some sort of risk while preparing this type of preparations. So it is highly recommended for the preparations to be taken freshly prepared one. Okay, so often request some preservatives. So these are all the various disadvantages of these preparations. And coming to the ideal properties of the monophasic liquids, along with the advantages and disadvantages, it has some ideal properties also. That is, it should be physically and chemically stable, and it should have a palatable taste, especially for the oral preparations, and should be non-irritant and free from microbial contamination. So all these are all the various properties required for the preparation of the monophasic liquid dosage forms. So classification of the monophasic liquid dosage forms. These dosage forms are divided into mainly 4 categories. The first one is the monophasic liquid dosage forms for oral use. So under these examples, mixtures, linctus, draughts, elixirs, syrups and drops. And the second one is the monophasic liquid dosage forms for external use. For these examples are lotions, liniments, collodions. And third one is the monophasic liquid dosage forms for special use. Under these examples are gargles, mouthwashes, throat paints, eye drops, eye lotions, ear drops, nasal drops and sprays, douches, enemas, inhalations, aerosols. And fourth category is the parenteral solutions, that is injections. Okay, so all these are all the various types of monophasic liquid dosage forms. Let us see the mixtures first. Formulation of the mixtures. A mixture is a liquid dosage forms intended for oral administration, typically containing one or more active pharmaceutical ingredients which are mainly dissolved, suspended or dispersed in a suitable vehicles. Such type of mixtures are called as mixtures. So the mixtures are often a biphasic one like suspensions, but can also be a monophasic one like solutions. Okay, so these are there are so many types of mixers are there. First one is the simple mixer, compound mixer, suspension mixture, emulsion mixture, linctus, elixirs and syrups, etc. Okay, so what is this simple mixer means? Here one or more suitable soluble ingredients are mixed in a vehicle. Example, paracetamol mixer. And second one is the compound mixture. What is this mixture means? It has a multiple active ingredients, possibly with both soluble and insoluble components are mixed in a suitable vehicles. Okay, and third one is the suspension mixture. They mainly contains the insoluble solids dispersed in a liquid. Okay, like biphasic one. And emulsion mixture. These are liquid in liquid system, like biphasic one only. And fifth one is linctus, elixirs and syrups, etc. They can be used as vehicles in a mixers. Okay, so coming to the formulation of the mixtures, it mainly contains active pharmaceutical ingredients, vehicles, sweeteners, flavors, preservatives, coloring agents, buffering agents, thickening agents, stabilizers and suspending agents. So first start with the APA, that is the active pharmaceutical ingredient. So first start with the APA, that is the active ingredient. The main purpose of adding this ingredient is to create the therapeutic effect. So that is a key ingredient for the mixes. And next one is the vehicle. So the use of the vehicle is mainly used to disperse the solvent here. Example, water, syrup. And sweetness. These are used to improve the taste of the preparation. Example, sucrose, sorbitol. Flavors. These are mainly used to mask the unpleasant taste of the preparation. Example, orange, mint. Flavors are needed to be added in the preparation, especially for the syrups. Orange, mint can be added into the preparation, especially for the syrups for children use. Okay, and preservatives. These are mainly used to prevent the microbial growth. Example, sodium benzoates. Coloring agents. These are used to improve the appearance of the preparation. FDA approved colors are needed to be included in the preparation. Buffering agents. These are used to maintain the pH levels. Example, citric acid buffers, sodium citrates. Thickening agents. So these are used to improve the viscosity of the preparation. Example, methyl cellulose, especially for the suspensions. And stabilization suspending agents. These are used to keep the particles suspended in case of bibasic one. Example, tagacan bentonite. Okay, let us see one example formula for the preparation of this mixture, especially that is a paracetamol mixture, 120 mg per 5 ml. Okay, so here what is this formula means? It has an paracetamol of 2.4 grams, sorbitol solution of 70 ml, glycerin 10 ml, saccharin sodium 50 grams, sodium benzoate 0.1 grams, flowers quantity sufficient, purified water up to 100 ml. So this is the formula given for 100 ml. We need to prepare for 5 ml. Okay. So coming to the general method of preparation of these mixes. First of all, we have to weigh all the ingredients accurately. So that is the first step. And then dissolve the soluble substances in a portion of vehicle like water. After that, disperse the insoluble components with a suitable suspending agent if any. After that, add the preservatives, sweeteners, flowers as required, and then make up to the final volume with the vehicle. Okay, so mix thoroughly and transfer to a clear label container. So this is the general method of preparation adapted for the preparation of the mixtures here. And coming to the storage and the labeling. So shake well before use is used for the labels for suspensions, and store in a cool dry place or refrigerator as needed. And they should be used amber color bottles to protect from the light, and clearly labeled dosage instructions and expiry date should be mentioned on the label. Okay, so all these are all the specifications of storage and the labeling. So this is about the mixtures. In the next video we will see other types of monophasic liquid dosage forms. Thank you for watching this video. Please subscribe to our channel for more videos.